All right, Dr. MJ, you're live and you're in the show.
Awesome. Glad to be here.
Yes, I'm so glad to have you here, especially because I know too that you're going to be a speaker for us in the next couple weeks at the Seek workshop, right? You and your dad, and we'll talk about it a little bit later. But I'm excited to get a prelude and from you about your work and about the work that you're doing in the community. And we're keeping our fingers crossed. Those of you who were here with me on, when was it? Wednesday, yesterday, our computer got frozen out. So we're hoping that technology will hold up today. All right, Dr. MJ, why don't
Yeah,
you introduce yourself to our audience?
absolutely. Yeah. Thank you again for having me. And just to share a little bit about myself. So, I am actually a diversity, equity, and inclusion practitioner. So, that is my background. And I have my own consulting firm. It's called Inclusive Excellence Consulting. And
Mhm.
basically, it's a full service DEI consultancy. And we work with clients of all organization sizes. We work with higher education institutions, healthcare, nonprofits, professional associations, and even the government. So,
Mhm.
a lot of what we do is centered around helping organizations become more equitable and inclusive in their practices. So, it's a little bit about me.
That's awesome. Awesome. So, in the health space, today we're talking about supporting marginalized communities through health equity and community engagement. So, what are you seeing in the DEI space, in the health space? How is DEI pertinent to health at this point in your career? What are you seeing?
Yeah, and you know what? That's a great question. And sometimes we don't always think about how health and equity are interconnected, but they're absolutely connected, right? Because what you find when you have different conversations, especially let's say I'm doing, some trainings and workshops for a hospital or for like a healthcare industry, something within the healthcare sector.
Mhm.
There are certain things that come up and you see it across sectors, right? That certain populations deal with unique issues that you may not see within every population. So, for example, a lot of underrepresented communities here in Memphis and other larger cities may deal with issues around pollution or deal with issues related to, food deserts or not being able to have transportation to go see a doctor regularly, right? And
Right.
so all of that is going to have an impact on your health. And if you're not able to get the care you need, ultimately, you're more likely to deal with different healthcare issues. And so it's absolutely imperative that we look at healthcare with an equity lens and that we look at how we're serving different populations and meeting the needs of those populations. And I will say this too, sometimes we take a one size fits
Mhm.
all approach to how we deal with patients and in my case clients. But the thing about equity and what makes it different from equality is that with equity you're meeting the needs of every person you're working with, right? Recognizing that what they deal with is going to be different, whereas equality is focused on sameness. So that's why I say it's so important to, as we do our work in communities, we have to always have that equity lens.
I love that explanation. And I want you to repeat it again because I think it's so important because people hear equity and they think, are they looking for equality? And it gets a little confusing when you talk about DEI, equity, equality. What are people looking for? So I loved how you explained it just now. Equity, and I'll let you say it again.
Okay. So equity is taking into consideration the unique needs of the individual you're serving or the individual or groups that you're working with. Equality focuses on sameness. So everyone have the exact same experiences. We're going to give them the same resources, right? And so it's all about equal. Whereas equity, you have to really look at, okay, what can we do for this particular person that's going to help them become healthier or to, to as they go through whatever they're going through, we have to look at it from the lens of what's best for that person.
It's almost like equity is customized,
Exactly.
customized service,
Yeah.
equity, customized to me, my situation. Equality is, it's a broad brush,
Right.
and it's not, it's really not. And I love that you say that because I'm hoping that the general population would understand because there's so much resistance at times to equity, equality, this, disparity in the mainstream. And I think if the general populace understood that equity just means see me and my background, my needs. I'm not saying to compare me to somebody else, just see me and meet me at my point of need. And that's just a human right, I think. It's just a basic human right. So I loved how you said it that way. And when you were talking about, you talked about it, the food desert, and you talked about pollution and these things. One of the questions that popped in my head as you were saying that, MJ, was, okay, how do we as a society, and or how do doctors, how do they react to, okay, this patient is from a food desert, this patient is from a polluted section of Memphis or Florida or wherever it may be. How does a doctor interpret that and then deliver care? Should they? How are they doing it now? What's the goal?
Right. So that's a great question. And that actually ties into the cultural competence piece that my dad and I will be talking about at the Seek workshop. But when you deliver care in a way that's culturally competent, you are aware of what diverse populations experience, right? And so that kind of ties into the equity as well. So when you have a patient who comes in and they tell you, well, I'm not able to exercise outside because of the pollution, or I'm not able to do XYZ for whatever reason. When you're using a lens that's centered on equity and being culturally competent, then you have to recognize that. And one of the things about cultural competence as well is that it requires you to engage in a way where you exhibit cultural humility as well. Because as practitioners, and even I have to do this all the time, I have to check myself and decenter myself, because I'll go into a situation and sometimes I'll think I'll know what's best for that person.
Right.
But sometimes we have to stop long enough and have that humility lens and say, wait a minute, am I listening? Am I really listening to what the needs are? Because they'll tell you what is best for them sometimes. And so sometimes we have to take that approach as well when we're engaging with people. So,
again, when you're talking, I'm thinking, I'm sitting in the doctor's chair in my head, and I'm thinking, this is what I'm thinking, a doctor who may not be as bought in. I'm thinking, you're asking me a lot. You're asking me a lot. You're asking me to go beyond the 15-minute in my office, okay, I'm looking at your diagnosis, your tumor or whatever. You're asking me to actually customize my care.
Right.
And what is my incentive? And I hate to say it that way, but I'm just thinking the reason why we're having this resistance at times is it's going to require so much. What you're talking about, and in the great solutions that we're all looking for, cancer equity, is going to require so much. And this is the reason why I'm so glad you're speaking this month at the Seek workshop, because we're going to be speaking to doctors there. And honestly, Dr. MJ, if we can alter, I don't know, one doctor per meeting, that they would go back to their practice and really look at patients from an equity perspective. You know how they say, well, I feel like I've done the work, the mission, and then hopefully we'll catch on. Because as you're talking, and as you're even saying, you yourself sometimes go and you have your preconceived ideas about how things should be, and it's not. So I want you to give doctors some tools, but let me see, I think you have a question here.
Okay.
Do you find that health institutions are interested in bringing DEI education to their teams? Is healthcare slower than other types of business to institute these types of programs? It's almost like what I was saying, like, all right, the doctor is saying, you're asking a lot of me, and I don't know. But that's a good question. What are your thoughts on that? And I'm having my tea for tea talk.
Oh, yeah, I like your teacup. So that's actually a really good question. What I found is that a lot of healthcare institutions, or a lot of health institutions, have not been resistant to learning about DEI and how they can engage in their practice in a way where it's equitable and inclusive. I think the biggest thing is what you pointed out just a few minutes ago about how it's difficult, right? So if you only have so much time with the patient, or if you have back-to-back appointments, providing that equity-centered care can be really difficult. And I'll tell you, that comes up a lot in other sectors as well. So it's not just health institutions. Even I used to work at colleges and universities, and that would come up like, we can't tailor every single thing for every student. And and that's understandable. So of course you still engage in best practices. You're going to do some things that are standard, but you still need to at least have that equity lens at all times so that you're hearing what people are communicating and you're always taking into consideration what their unique needs are. So yeah, it is tricky. It's difficult, but it's necessary if we're going to provide care in a way where every patient can benefit from it.
How do you get past the noise that's surrounding DEI nowadays? And I don't want to touch on any kind of anything political, but I just keep seeing DEI in the news all the time, and it's not necessarily favorable. And I'm just thinking, if we took, I interviewed, I don't know if you know Amira Barger. She works in the DEI space, and I had her on Tea Talk a few weeks ago, and she called it IED.
Yes.
And I said, and I figured it out like IED. Okay, inclusion, equity, and diversity, because I felt like it was less of a triggering buzzword. And honestly, I would do away with the word diversity. I would even do away with the word inclusivity. I just keep equity, because equity is a basic human right. And I'm just wondering, how do you get past the noise, and how do we educate people to understand that equity is just a basic human right, and that people are dying at disproportionate rates because they're not being treated equitably, and that's just a human concern.
Yes.
So what are your thoughts on that?
I love that. First, I like IED, and I don't know if you've seen this one, JEDI. So it's justice, equity, diversity, inclusion. That's
no, but I love it.
It was cool. I was like Star Wars. I'm a Star Wars fan. But I've seen that too, and I get the rationale behind it, right?
Yeah.
Because like you said, DEI has been getting a lot of attention, especially in the media and everything. But I always say, when you think about the work, you have to start with equity in mind anyway. So I am in complete favor of, okay, well, we will look at it purely from an equity lens, because the other things will fall into there. Like,
Yes.
so you're looking at it from, okay, how do we create a space where every person feels like they can thrive, where every person has their unique needs met? Then you're automatically taking diversity and inclusion and belonging and accessibility, right? All those other things into account when you're thinking about it in terms of equity. So actually, I like the IED, I like the JEDI, and I like just, hey, equity-centered care.
Yeah, that me too. I feel like we're just here to get the job done. We're here to get the job done. Cancer Equity Project, which is our nonprofit arm, Total Health, spawned that arm a few months ago. But it's really just to address the equity, because the founder, Sarah Loudon, she's in the oncologist space. She's hearing the conversations. She's hearing about the disparities. She's hearing the numbers, and she's saying, wow, people are dying. They're dying because of inequitable care. What can we do? And I would hate to see a movement like what we're doing and what you're doing just be rejected because it's called DEI. I mean, I'm ready to throw DEI out the window.
You're not alone. I've been thinking like my company name, because I'm like, it's still DEI work, even if you call it equity, but
yes,
it comes up a lot. Yes.
Yep.
You're not alone.
I'm all for just the equity, because again, I keep going back. Equity is a basic human right. Ilana says, are there any simple changes health practices can institute? If so, can you give us a couple of tips? It's a good question. I was going to ask that of you too. So the doctor listening to this program, or who'll be listening to you at Seek, at the workshop in a couple of weeks, What are you going to tell them? What can they go back to their office if they agree with you, and if they agree with the other speakers, and they believe, okay, let me look at my patients differently, especially we're speaking in Memphis,
Mhm.
and there are issues that we hadn't considered before, but now we're made aware of it. What can I go back to my office and start practicing?
Yes, that's an excellent question. And I'll tell you, my dad and I have started, we're planning out our session and, we're excited. Okay, because we have a lot to say, but we know we have to like hone it in 20 minutes. We got to like hit the good points.
Yes.
A lot of it, like, especially we're talking about cultural competence, which is an area I love talking about. And a lot of it can be implemented fairly quickly. Sometimes we think about equity work as, oh, it's going to be complicated, but even just something as simple as, are your forms or is your website accessible, for example?
Mhm.
Or do you have someone who might be bilingual in the office who can communicate with patients who may not speak English? As an example of something you could do fairly quickly. Is everything accessible when they come into the office? Is it like accessible from a disability inclusion standpoint?
Yes.
And so there's so many different ways you can look at it. And that's why I say when you have an equity lens, or when you learn how to sharpen your equity lens,
Yes.
you start looking at everything around you like, oh, maybe I need to modify this a little bit so everybody can see the mirror, maybe bring the mirror down a little bit. Or,
Right.
it's just so many small things. And I could give a million examples, but I would definitely say, as we talk about what cultural competence is, I'm hoping that people will walk away with, okay, well, that's helping me to think about how to be more aware of different people and their different needs.
It's education, and as you said, when you mentioned sharpen the equity lens,
Yes.
again, I think it's a soft way of introducing the concept to doctors who nobody wants to feel like they are discriminating. Nobody wants to feel like they are, in any way, racist or so. And they confuse equity with, oh, you're calling me a racist, which is not. It's just sharpen the lens. You mentioned disabled people. Well, those people can be any race, right? But do you have a ramp to accommodate them, right? There's short people, there's tall people. The short people can't see that mirror, And I learned yesterday on Tea Talk from the West Cancer Foundation that there were a lot of Hispanics. When you think Memphis and you watch television, what do you see? You see Memphis, you see African Americans. You equate Memphis with African Americans. Unknown to me that there was a large Hispanic population in Memphis, growing and growing in poverty, unfortunately.
Correct.
I heard yesterday. And so, again, equity, like you said, is there someone in your office who is bilingual? Are
Right.
your forms bilingual?
Yes, exactly.
It's just simple, caring things like that make such a difference, you know.
Yeah, it makes a huge difference. And sometimes, like I said, I talked about decentering myself, or, the need to decenter yourself sometimes, because we'll go into a situation and, like I said, we'll assume what's best, like, oh, this is
Mhm.
going to be best. And you don't always think about, oh, but is this accessible to everyone? Do I
Yeah.
have patients who can come in here right now and understand exactly what's written on the form, or who can
Mhm.
speak to the receptionist? And just the smallest things can make a world of difference in creating, a sense of belonging for patients. Like, okay, well, I feel comfortable going to the doctor because I can actually speak to the people who are there, right?
That's right. That's right. You mentioned community engagement. What does that look like in your world? Community, because I'm the head of community engagement for Total Health, and what does that look like in your world? How are you engaging the community?
Yeah, for me, I think it's essential. And I think equity work and community engagement are definitely tied together, because a lot of what we do is collaborative.
Hmm.
So when I think of community engagement, the first thing I think of is, okay, we're out here engaging with different stakeholders, whether it's, politicians,
Hmm.
different industries, different organizations, in order to create awareness, to come at it from not just one person trying to do the work, right? When you have a collective, what's the analogy? Here's the analogy I'm thinking of. Like, if you're a finger, you might be able to push something so far, but when you come together as a fist, when you have
Yes.
multiple fingers coming together, right, you make a bigger impact. And it's the same thing with community. When you have multiple stakeholders who are invested in seeing change and helping certain populations, and you're more likely to get results that way.
I agree. Something that Leanne from West said yesterday, that they weren't about duplicating efforts, which I think it's a good model, because there's so much work to be done that you can't do it by yourself. We certainly can't do it by ourselves, right? But you're coming to speak on issues and topics that we're not necessarily that versed in. So we're getting you involved and your world and your experience. And we have some experience. We can bring the doctors there, and together we can make this thing work. And I think the whole aspect of community engagement with the politicians, with other advocacy groups, with patient communities, it's the way how we're going to collectively, the finger and the fist. I love the finger and the fist. It's a good one. That's how we're going to get this message across and impact changes. One of the things that frustrates me personally, MJ, is there's so much talk, right? There's a lot of talk about what we should be doing, and yes, there are some actions too.
Mm-hmm.
And that's one of the reasons why we began to seek workshop, because we said, okay, when we were planning it, we thought, okay, let's bring the doctors in, let's have a workshop, and then we'll call that, we'll say they're educated. But then we're like, no, let them go through at least 3 workshops.
Nice.
So that they can reinforce the idea, right? They can reinforce the training. And then we're even planning some follow-ups later on. Just like you said with your dad, what can you do? What have you done since you've attended the workshop? Have you changed your forms? Have you hired a bilingual person? What have you done? Because there's so much window dressing on DEI, really, which is one of the reasons why I think, okay, throw it out, because a lot of it is window dressing. But the whole aspect of equity, for me, again, it goes back to people are dying because of misunderstanding, lack of education, lack of action, and too much talking. So I know in the last few minutes that we have here, I'm gonna let you just address what I said and what you think are, the best next steps, the best next practice. What is your advice to us as the Cancer Equity Project, nonprofit arm, or even to Total Health, who's co-sponsoring that Seek workshop?
Yes.
What you as a consultant in this space, there's work to be done. Where is it? Where's the work lacking? Where's the efforts lacking? And what is your advice? I know it's a lot of ask, but Yeah,
it's an excellent question, because you are exactly right. I think a lot of people have dismissed the work because they're like, well, it's not really working. And part of the reason it's not working in some instances is because we treat it like a one-off, like, okay, we'll do this DEI training or we'll do this equity training, and we're good. Whereas it has to be ongoing, right? It has to constantly be reinforced. You have to talk about it regularly, and then you have to put some strategies in place. Like, okay, we've talked about it. We have a collective understanding of how to engage in equity-centered care, for example. Now, how can we put this into action? So, I mean, it's ongoing and it takes time. And I think that's where people kind of get frustrated with it too. I told somebody the other day, like, being a DEI practitioner is hard at times because I live at the intersection of people want change right away, but it takes time.
Right.
So I'm trying to meet people in the middle, like, hey, I understand that you want me to train all 4,000 of your staff in 6 months. But, realistically, we have to look at this as a long-term thing, right? And we have to treat it that way. And then we have to also think about what actionable steps can we put into place to execute all of the things that we're trying to achieve. So yeah, it's a lot. It's difficult, but I still think we can have a huge impact in health. We can have a big impact in education and just all types of sectors if we go about it with the mindset of, okay, this may take time, but we're going to put the action steps in place to execute and affect change.
So when you were talking, my head works weird. So I was thinking of what you were saying in my head as a coach, coaching a CEO or coaching a company, and coaching them on a strategic plan. And just like you said, you create the plan, but it's not going to happen overnight. It's like a 3 or a 5 year plan, right? And have to be action steps, goals, and action steps to the goal, and then examining if it's working. And that's exactly what it is here in trying to implement equity in the healthcare space or in any space. It's going to take time, and I do believe that it's going to take a lot of commitment. It's
Yes.
not something you say with your lips because it's the latest buzz, but it's something that you have to believe at your core. You have to believe that equity is a basic human right. You have to believe that having diverse people in your organization is actually good business sense. It's the right thing to do. You have to literally believe it, not just be doing it
Yeah.
because it's the quote because you were told it was the right thing to do. So I love that you said that people are hiring you for 6 months and they want it to be immediate,
Right.
but but they didn't get here in 6 months. It's been a long time of an alternative way of thinking, and we're here. And now you want to change your thinking in 6 months. It's going to take time. So I do love that you share that.
Yes,
So
absolutely.
T talks, it's T cells based on the T cells in our body.
I
It's the
like it.
happy cells. And so we like to ask our guests to leave us with something that's inspiring, uplifting, hopeful, that we can end this broadcast with as a T talk show. So your last word to the listener who's going to be watching the replay or the reshares. What is your last word that would energize our T cells today?
Yeah, I love that. That's clever. I would say I feel hopeful, although I know there is some pushback on do we really need all this equity work and everything, but I still feel really hopeful. And I'll tell you why. Generation Z, the younger generations, they are on it. And I'm
Good.
looking at them and their commitment to social responsibility and equity. And they're kind of coaching us. They're coaching up a little bit. And so I guess that was the first thing that came to mind for me, because as I think about the work and I think about all that we're achieving in the field, it's nice to know, okay, we do have young folks who are coming in too, who are committed to this, who can potentially help us think about this even differently. I
Mm.
learned so much from like some of the younger generations, and I'm like, wow, I never thought about it that way. Thank you for educating us. So I think together we can teach each other. We're advising and then they're advising. So I would say, yeah, for up and coming physicians and nurses, just know that you can have a big impact on the field.
Awesome. There was one last person that snuck in,
Oh,
who happens to be my husband, by the way.
that's
Things worth having are rarely minted overnight. It takes time, commitment, and struggle to effect change in any environment, never mind DEI, which is intrinsically difficult and now more and more political. Thanks for the perspective. And with that, well said, Wayne. With that, I pray blessing in your work. Raquel says, this was such an informative tea talk. Thank you. And Raquel is one of our program coordinators for the Tea Talks and for the Seek workshop. So Raquel and Madison, who spoke earlier, Madison is the one you're going to actually meet in Memphis on the 17th.
yes.
So they'll actually meet you in person. So she's saying, so excited to hear your session and the upcoming Seek workshop. We loved having you. We're gonna love having you and your dad
Yes.
speaking on this topic in Memphis. I can't wait to watch the sessions. I won't be in Memphis, but they're gonna record, so I can't wait to hear you. But it was good to I got to taste you first.
Yeah. And my dad that's who I learned it from, a lot of this. So
Right.
so he can really speak to certain unique things within the health industry that I can't, because I'm not an actual healthcare practitioner. But yeah, no, we're excited to like kind of tag team on this. Like, all right, let's do this.
Absolutely. I know it won't be the last time you're on this show either, because maybe the next time we're going to talk about even some more practical things that
Okay.
we can give to the practitioner. Maybe we'll come with some charts, maybe we'll come with some forms and do,
Okay.
share screen and show, hey, do this, try this. So look out for another note from me to book you maybe towards the end of June, where we're going to talk about practical strategies for oncologists and that healthcare system. Thank you so much for watching and for all the comments. For those of you who are watching live and for those of you who are watching in the replay, you can follow. I'm going to put a link to MJ's LinkedIn profile. Follow her and support her in any way you can. Thank you, MJ. Stay back, MJ. I want to say goodbye to the broadcast, but I want to talk with you for 2 more seconds. All right, everyone. Bye. See you on